Hello, everyone. My name's Sean Weaver, and I decided to do my presentation here on community health regarding homeless populations of La Crosse, Wisconsin, and getting sort of a plan implemented. So we'll just get started here. So the introduction and key issues reviewed here. The purpose was to identify barriers affecting individuals experiencing homelessness within La Crosse. Population was, again, individuals without stable housing or experiencing housing insecurity. And then the focus was identifying barriers to healthcare access and develop public health nursing interventions. So some of the key issues here. The individuals experiencing homelessness were at increased risk for chronic health conditions, mental health concerns, substance use disorders, delayed healthcare access, especially increased emergency department utilization. And some of the contributing factors were lack of stable housing, limited financial resources, difficulty maintaining follow-up care, and transportation barriers. And essentially, healthcare becomes quite challenging when basic needs such as food, safety, and shelter become the priority. And things go to the wayside when you're looking for food, water, and shelter. So, yeah. Some of the community assessment methods I used. I decided to use a windshield survey, a key informant interview, and then a general survey of what the resources are available that are on La Crosse right now. So the windshield survey findings, I observed, essentially, I've lived here for about 6 to 7 years now. So I observed multiple individuals experiencing homelessness in downtown parks and walking throughout the downtown area, and community resource centers like, for instance, I suppose the Salvation Army, they were there. However, they appeared to be overall just underutilized, so to speak. I popped my head in there twice while I was running around in town, and I noticed that there wasn't too many people in there, if at all. Now, it could have just been the time that I went. One time I went at like 10, and the other time I went running, I think it was like around 5:30 p.m. And I didn't really see too many people in there, so I don't know if people just don't know about it or if they're just not using it. I also noticed that some of the public areas, especially the parks, were in a state of disrepair and poorly maintained, suggesting environmental and social challenges, and the overall resources spread throughout the city, requiring individuals to travel between different hospitals, shelters, pharmacies, food programs, and health services. So, yeah. Key informant. So for my key informant, I spoke with a hospital social worker on the floor that I currently work on, and essentially she works with a lot of underserved and just the general underserved patient populations. And she explained one of the greatest challenges was essentially maintaining the continuity of care for patients after they were discharged, because many of them don't attend the follow-ups because of transportation barriers, unstable housing, or difficulty prioritizing their overall health whilst trying to maintain basic needs. She also described how homelessness is often accompanied by complex mental health conditions, which substance use disorders and overall financial hardship, making it difficult for patients to essentially take medications, manage chronic illnesses, and navigate the healthcare system while juggling everything that's going on. She also emphasized that patients require coordinated support from healthcare providers, social service, and community organizations to improve long-term health outcomes. And essentially, she was just saying that there's a lot of moving parts involved with it. And yeah, so that was her take with it. And then the survey of existing agencies. So I reviewed some of the local organizations that currently serve the La Crosse populations, and that would be there are like emergency shelters set up through Catholic Charities and Salvation Armies, the Salvation Army. There's case management, resource navigation, and food assistance and basic support needs. But what I did notice is that, while glancing around, is that there's few, if any, nurse-led healthcare services, and the majority of them seem to be volunteer-based. So, yeah, so nurse-led outreach programs would complement existing community services rather than exactly copy them. So, yeah. Okay, so problem identification. So public health problems that individuals experiencing homelessness within La Crosse face significant barriers to accessing consistent preventative and primary care. So let's see here. This is a priority because the community assessment identified barriers, including unstable housing, transportation challenges, missed follow-up appointment, medication management difficulties, and coexisting mental health and substance abuse. So essentially, if we can stop these people from, or not stop, but essentially help them before something becomes a problem, such as managing their diabetes medications or taking care of chronic wounds that they may have, can prevent them from essentially overutilizing ERs and essentially overutilizing ERs and the current hospitals that are in place here. Because it seems like a lot of the homeless population that comes into the hospital right now have issues that can largely be taken care of before they can come in. So, yeah. And then some just general nursing literature that I found that would back it up. There was one from McWilliams and then one from Roche. And essentially they were just saying that basically if nurses take the lead and provide long-term relationships with these in-need populations, they are going to essentially, the population will fare much better than if they had not taken action. So nursing diagnosis here. It's been a minute since I've written one, but the problem that I'd say is that the ineffective community health management amongst individuals experiencing homelessness in La Crosse, and I would say that it's related to unstable housing, limited access to consistent preventative health care, and mental health and substance use disorders. And that's evidenced by, according to the social workers and people I've talked to, and general data found that difficulty attending follow-up appointments, challenges managing chronic health conditions and medications, limited availability of nurse-led preventative healthcare services, and findings from the Windshield survey, just what I said, key informant interview and survey of existing agencies. So, some SMART goals here. For my first one, I said within 6 months, establishing monthly nurse-led outreach programs at 2 community locations. So that could probably be something like the library or a public park. Objective 2, within 6 months, provide preventative health screenings. So it'd be something like blood pressure, blood glucose labs, or overall labs for like something like Hep C, Hep B, HIV, this sort of stuff, and just overall assessments to at least 100 individuals experiencing homelessness. And then within 12 months, connect at least 75% of the program participants with some sort of primary care provider or appropriate community health resource for ongoing follow-up and care. So, proposed program. The proposed intervention in La Crosse community is just be dubbed La Crosse Community Health Outreach Program. This program is designed to help address healthcare barriers identified during my community assessment. Rather than replacing existing shelters or housing services, the program would essentially focus on bringing preventative health care directly to individuals experiencing homelessness. The overall goal is to improve healthcare access, strengthen continuity of care, and connect participants with existing community resources. Okay, so the program will be delivered through monthly outreach clinics held at locations already serving individuals experiencing said homelessness, and public health nurses would provide basic preventative healthcare services, including screenings, medication education, wound assessments, and chronic disease education. A nurse practitioner and a social worker can help participate to help address immediate healthcare concerns or someone to write orders and connect individuals with primary care providers, mental health services, and other community resources. And locating the program within existing agencies would reduce transportation barriers while strengthening collaboration rather than essentially duplicating the services. So essentially putting something downtown or putting something near the library where a lot of them congregate would help alleviate the transportation problems. Okay, so some overall barriers is that could affect successful implementation from the program, or for the program, would be essentially obtaining the long-term funding for staffing, supplies, and transportation would likely be one of the greatest challenges, as that's usually what it always comes down to. And successful implementation would also require collaboration among multiple community organizations to coordinate services. And there's also barriers within the target population. Individuals experiencing homelessness often face mental health conditions, substance use issues, transportation, again, everything I was harping on before, and overall housing problems, and limited financial resources. In addition, some of these individuals, generally speaking, at least from what I've observed, have a general overall distrust of the healthcare system because of negative experiences or facing some sort of stigma within their hospital stays. And many are focused on meeting immediate needs such as food, shelter, and safety, making preventative healthcare essentially a lower priority. for this group of people. So yeah. Okay, so then this is what I had for that nursing wheel. So outreach, or for what I read from the PDF file, is that to deliver preventive healthcare services directly to individuals experiencing homelessness within the community, teaching participants on chronic disease management, medication adherence, preventative health practices, and coordination referring to primary care, mental health services, housing resources, and other community agencies, and collaboration partners with shelters, social work, public health agencies, and healthcare organizations to improve continuity of care. Okay, so program resources. The resources needed for this program are fairly straightforward. Personnel would include a public health nurse, nurse practitioner, social worker, and community volunteers if able to assist with outreach activities. Again, operate from existing community shelters in order to cut down on costs and improve accessibility. Basic equipment would be just blood pressure monitoring equipment, glucose testing strips, wound care materials, and education handouts. And I'd estimate that the program, to staff it with nurses and a nurse practitioner, social worker part-time, would probably be, and supplies and everything to cost, would probably be around 100 to 150,000 to operate something like that. Okay, so program marketing would be primarily through organizations that already work with individuals experiencing the homeless. It would already essentially target, basically, I would want hospital discharge planners, like emergency departments, social workers, and case managers could refer eligible participants who are already in the hospital to programs such as this. Additional outreach will also include flyers posted at shelters, food pantries, libraries, and community centers where individuals commonly seek services, because many individuals experiencing homelessness may have limited access to phones or internet, and so low-cost community-based methods such as word-of-mouth referrals, bulletin boards, and radio announcements could make something like this more effective than relying on social media or the news alone, kind of thing. So the program evaluation. So I suppose we could evaluate the program at 6 months and then once again at a year. And the evaluation would focus on whether essentially that the SMART goal, whether the SMART goals or the objectives have been met, and measuring the number of participants served, health screenings completed, and overall referrals made to primary care or other community resources. Also, you can have satisfaction surveys from the overall population that we're taking care of to help understand to better understand the program's strengths and weaknesses and areas overall needed for improvement. So essentially the combination of quantitative and qualitative data sets would help determine whether the outreach programs improved access to preventative healthcare for individuals experiencing the homelessness. So, yeah. So, in conclusion here, the project focused on assessing healthcare barriers experienced by individuals experiencing homelessness in La Crosse. My community assessments, which include a windshield survey, a key informant interview, and a survey of existing agencies, identified several barriers to accessing consistent healthcare. And based on these findings, I proposed a nurse-led outreach program designed to provide preventative healthcare services, education, and referrals while working aside existing community organizations. And overall, the program would have the potential to improve access to healthcare, strengthen continuity of care, and support better outcomes for this vulnerable subset of populations. So then I have my two resources from McWillis and Roche here, and then I also just included a couple here from La Crosse County, because I thought that was useful too, to look up some general statistics on the homeless population. So, cool. Thanks for your time and have a good day. Bye.